The staff at the Baduraliya Government Hospital has taken steps to temporarily shut down the operations at the hospital.
According to the staff, they had resorted to this measure over death threats being made at the staff, including the medical officer in charge.
An argument had broken out over a delay in administering treatment to a patient who was brought to the Baduraliya Hospital early morning on the 18th.
He said he felt weak. He told us that he was suffering from a stomachache and was throwing up. I directed for an ECG test to be taken. The warden said that the result was poor. Then I took measures to transfer the patient in question to the Nagoda Hospital for further treatment. The next day he had died at the Nagoda Hospital. Later a group arrived and threatened me.
The final rites of the patient who died were performed yesterday. Subsequently, a group had staged a protest opposite the Baduraliya Government Hospital. The staff at the hospital had decided to temporarily shut down the hospital and took measures to transfer all the in-house patients to the Nagoda Hospital.
This incident had taken place when the group was not pleased with the time taken by the medical officer in charge to inquire into the patient. The hospital staff says that the group was under the influence of alcohol, but the group is saying that they weren't and they were seeking justice. This is the cause for this problem. My request is to relieve me from these death threats and an apology be made, and also for the staff to continue their work independently at the hospital.
A discussion took place this evening under the auspices of the Western Province Health Minister Jagat Angage over reopening the hospital and the issues in question. Our attempts to contact the Western Province Health Minister to inquire the decision that was reached proved futile. However, patients who arrived for treatment at the hospital said that they were severely inconvenienced by this act.
This closure is a big loss and very unfair to the patients.
Many patients came to the hospital and they had to go back. My child has high fever and we have no way of admitting him because the hospital is closed. We have no place to take our child either. We didn't even know about this. We had to travel about 12 kilometers by vehicle to get here. They've closed down and gone off like it is a private hospital. Many of the patients are from rural areas. Around 400 to 500 patients obtain medicine from this hospital daily. So these people have no way of getting medicine due to the closure of the hospital, and it is highly inconvenient. We are against this move.
Who let this mistake happen? Who will claim responsibility for this? Will a proper investigation take place?